Hi there, this is Dr. Dana Gibbs. This is the Allergy ABC series. Today we are going to talk about my favorite medication that I recommend to my patients for allergy and sinus symptoms.
This video is for information purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of information in this video or associated links is at the user's own risk. The content consists of the opinions of Dr. Gibbs and is not intended to substitute for personal, professional medical diagnosis, treatment, or advice. Users should not disregard or delay in obtaining medical advice for any medical condition they may have or suspect, and they should seek the assistance of their healthcare professionals for any such conditions. Hi, it's Dr. Gibbs again. Let's talk today about my favorite allergy medicine. When was the last time you walked down the aisle in the pharmacy looking for an over-the-counter allergy or sinus medicine? If you're like most of my clients in my office, this task can be very confusing. Do you know why? It's because most of what's on the shelves is comprised of the same few ingredients in different combinations over and over again. But there are some really good allergy medicines that you can get over the counter if you know what to look for. So today I'm going to focus on allergy congestion, postnasal drip, and sinus pressure. So topical nasal steroids are actually the most effective class of medicine for long-term control of these allergy and sinus symptoms. Why they work so well is a topic I'll be addressing in another presentation. In my practice, fluticasone propionate is by far the most recommended topical steroid. It's actually the 16th single most common prescription medicine, even though it's been available over the counter for several years. That's brand name Flonase, as you might remember, and it is available in a wide variety of generics. This is Costco's brand, and 5 bottles at Costco last week was $17.99 for 5 months supply of this medication. Topical steroids are really effective if they're used correctly. They reduce all the nasal symptoms with no addiction, no withdrawal symptoms, and no loss of effect over time. In fact, they get more effective the longer you use them, up to about 90 days of continuous use. Also, they're safe down to about age 2. There are several other topical steroid sprays that are available that have somewhat different extra ingredients, so they may have somewhat different side effects as a result. They can be combined with antihistamines for an even stronger effect. Your side effects are mostly related to preservatives or improper technique, and bloody nose is the most common. So if you tried topical steroids before and you didn't see great results, there's a few things that are probably going on. I'll address technique in the next video, but the kicker is these sprays work best as prevention. They work slowly. They take about 10 days to get to a good effect if you're already sick once you start. Similar to brushing your teeth for cavity prevention, ideally you want to use them before you get the symptoms, by about 2 weeks, and then daily during your allergy season. And don't stop just because you have a good day. The good effect can be lost by about the 3rd day of not taking it, and then you have to start over. So most of the topical steroids, including fluticasone propionate, are recommended in an adult dose of 2 puffs in each nostril one time a day. Once you're feeling good for a while, you can try to cut back to 1 puff on each side or use it every other day. And if this technique doesn't work or you're noticing side effects, I recommend to see your doctor or an ENT specialist. Also, a nasal and eye exam is recommended annually for patients who use these sprays regularly. Hope this helps. Talk to you again later. Bye now. If you find these videos informative and entertaining, please don't forget to share, like, and subscribe so you won't miss new information as it's released. If you have a question you'd like me to answer on a future episode, you can comment below or email me at info@danagibbsmd.com. Thanks for watching.